what's up?
Hey girl, yeah man, I'm alright.
You know, so the other day, I got a doctor, and doctor said me if I go come back and I'll do some tests, all the urine tests. But I don't know where you do urine test. I don't even know how to do one urine test.
Oh, a urine test? You know, some of you say a simple process that I don't think it complicated and I don't think it painful. Yeah man, so I think you can go on YouTube and find more info on that.
Alright, me go watch some video on YouTube and see if me find out how they do it and where you do it for.
Yeah, YouTube have everything. So check on YouTube man. Yes, alright then. Talk to you later. Yeah man, alright.
Alright, later.
Hi everyone, welcome to our YouTube channel. On this episode, I will be giving you some information on how to prepare a patient for a urinalysis. Firstly, it is the duty of the healthcare provider to inform the patient on the type of sample that will be needed and how this sample will be collected. The patient should also be made aware of whether this sample will be collected at home, at the office, or at the lab. The patient should also be briefed on the type of specimen that will be used, whether it will be a random urine specimen, a first of the morning urine specimen, a midstream clean catch urine specimen, or a timed urine specimen. When preparing for a urine test, patients don't normally have to fast or change their diet. However, the patient should be made aware that they may be asked to fast for a period of time depending on what is being tested for in the urine. Example, a patient may be asked to fast when testing for ketones in the urine. It is also important that patients be made aware that certain medications, remedy, or herbs and anesthesia, also intravenous dye, may affect the results of the urine test, and as such, the patient should inform the healthcare provider of any substances or medication that they are taking.
Fakisha, Panawanya, Fakisha. First thing in the morning, when me wake up, I go take a pee. Something around urinalysis, it's all the best. Medical diagnosis, when your kidney is stress. Container clean and dry, urinating it like it tight. No matter what me try, can't eat, can't sleep, I gonna what is my eye. No lie, I pretend, pain not tell me, I tell me friend. Me the doctor with down a current, doctor now call me when.
Hello everyone, I'm Tamisha Pinnock. I'm from Group 2 and I'll be presenting on the handling of the samples. In order for us to handle the samples, there are some few guidelines that we must follow. The first, the container should be clean and obtained from your healthcare provider. Also, the urethral area should be clean in order to prevent contamination of the urine specimen. When urinating in the container, avoid touching the inside of the container and also catch the midstream of the urine. When taking the urine specimen to the healthcare provider, it should be covered in order to prevent spillage or contact with any other person or the healthcare provider. Unless otherwise notified, it should be refrigerated and you'll be instructed as such.
Hi guys, I'm Tashira Sinclair and I will be explaining how the test is done. So according to Medline 2020, a clean catch method is used for collecting urine samples to be tested. This method is used to prevent germs from the penis or vagina from getting into the urine sample. The patient will be given a special kit, and it includes a sterile cup with a lid and also sterile wipes. The sterile cup will be labeled with the patient's name, date of birth, and the date the sample was collected. So in collecting a sample for a female, they should spread their labia and use the first wipes to clean the inner folds of the labia and wipe from front to back. They will then use the second wipes to clean the opening from where the urine comes from. So keeping your labia spread open, urinate a small amount into the toilet bowl, then stop the flow of urine. You will hold the cup a few inches or centimeters from the urethra and urinate until it is about half full. You may finish urinating into the toilet bowl and then wash your hands thoroughly. For males, they should clean the head of the penis with the sterile wipes. If they are not circumcised, you will have to pull back the foreskin first. You will urinate a small amount into the toilet bowl and then stop the flow of urine. You will then collect the sample of urine into the sterile cup until it is about half full. You can then finish urinating into the toilet bowl and wash hands thoroughly after. If this sample is not used within an hour, it should be placed in a sealed plastic bag and placed in the fridge. No sample should be kept longer than 24 hours. A clean voided specimen is usually adequate for routine analysis. So many clients are able to collect a clean voided specimen and provide it independently with minimal instructions. For a male client, they generally are able to void directly into the specimen container, while for a female client, they usually sit or squat over the toilet, holding the container between their legs during voiding. At least 10 milliliters of urine is generally sufficient for a routine urinalysis. After voiding into the container, they should put the lid tightly on to prevent spillage of the urine and contamination of other objects. If the outside of the container has been contaminated by urine, clean it with disinfectant. For a 24-hour urine collection, the patient will be given one or more containers for collecting and storing their urine. A special pan that fits in the toilet or urinal may be used to collect the urine. They will then need to transfer the urine from the collecting container to the storage container. And as stated earlier, the sample should be kept cold.
My name is Ladisa Golden, and I will be interpreting the results for two tests that were done. The first test is the ketone urine test. Now, the ketone urine test measures the amount of ketone that are presented in the urine. However, the body uses glucose as a source of energy. However, if the cells get little or no glucose, it turns to fat for energy, which leads to the production of ketones in the body. Now, normal ranges of ketones is 20 milligrams per deciliter, which is relatively normal. However, moderate measurement of ketone is 30 to 40 milligrams per deciliter, and an excessive amount is anything that is over 80 milligrams per deciliter. Now, if a patient is have excessive amount of ketone in their diet, they are in a life-threatening condition, because too much or too little ketones in the blood, or the urine rather, may have a negative impact on patients. So a urine ketone test is a non-invasive way of measuring or checking the levels of ketones in the body. When using a color strip, there are important details that one must consider. If the color of the strip changes, it is an indicator that there is ketones in the urine. So to know if the number of ketones in your urine is small, moderate, excessive, you have to compare the color with the ketone chart. So if there's a small trace of ketones, it is an indicator that ketones is starting to build up. If the reading is moderate to excessive, it is a warning sign, and therefore patient must immediately contact their doctor for help. However, the result varies. That is, depending on the type of urine test strip used, there are different brands. While some give the present results in numbers, others indicate if there is a trace, whether it's small or large amount. The other test that is done is the urine glucose test. A urine glucose test is a simple and quick way to check for the abnormally high levels of glucose in your urine. Now, glucose is a type of sugar that your body requires and uses for energy. That is, our body converts the carbohydrates that we eat into glucose. Normal ranges of glucose in the urine is 0 to 0.8 millimoles per liter. A higher measurement could be a sign of a health problem or a health condition. Now, conditions associated with high levels of glucose in the urine is diabetes. Now, diabetes is one of the most common cause of elevated glucose. In some cases, rather, it can be due to pregnancy. So, pregnant women tend to have a higher risk of urine glucose than women who are not pregnant. Now, another condition associated with elevated levels of glucose in the urine is renal glycosuria. Now, renal glycosuria is a rare condition in which the kidneys release glucose in the urine. Renal glycosuria can cause urine glucose levels to be high even if blood glucose levels are normal.
There are two types of urine tests to check for the presence of protein. One, you have the dipstick urine test. The measuring range for this test ranges from 0 to more than 200 milligrams per deciliter. The normal protein range in urine is 0 to 10 milligrams per deciliter. Therefore, anything above 10 milligrams could be a problem. The second test is called the urine albumin to creatinine ratio. The normal range of albumin to creatinine ratio is less than 30 milligrams per gram. A ratio of 30 to 300 milligram per gram suggests a moderate increase of albumin and is known as microalbuminuria. Any range above 300 milligram per gram suggests a high level of albumin and is known as macroalbuminuria. If your urine protein levels are consistently high, it may indicate kidney damage or other conditions such as UTI, urinary tract infection, lupus, high blood pressure, diabetes, among others. Specific gravity of urine. Urine specific gravity measurements range from 1.002 to 1.030. Results that fall between 1.005 and 1.030 suggest that your kidneys are working properly. The low specific gravity of urine would range from 1.001 to 1.003. Any results above 1.010 can indicate dehydration, and the higher the number goes, the more dehydrated you are. Decreased urine specific gravity may be due to damage to the kidney tubule cells, diabetes insipidus, drinking too much fluid, kidney failure, among others. An increase in the urine specific gravity may be due to conditions such as heart failure, high sodium level in the blood, sugar in the urine, dehydration, among others.
Urine is a very important excretory product that comes from our body, and a wealth of information can come from it about a person's health. A urinalysis is a simple test that is not painful, and all that is required is a sample of urine. It can detect, diagnose, and monitor certain health issues that a person may have. Specimen can be observed visually, or a microscope can be used, as well as a dipstick can be used. So observations can be made based on the color of your urine, the level of transparency, or how concentrated it is. One can pay attention to the odor, or a microscope can be used to see certain bacteria that may be present, stuff that cannot be seen with the naked eye, or a dipstick can be used. Analysis may be done as a regular part of a checkup examination when a person goes to the doctor, or the practitioner may recommend it to the patient if the patient is having abdominal pain, frequent and painful urination, or it can be used to monitor the treatment of certain diseases, for example, kidney diseases, different health issues that can be diagnosed using our urine. Firstly, we want to look at the color of your urine. So, a person's urine color is dependent upon their diet, what they're eating, what they're drinking. Darker urine may signify that the patient may be dehydrated. Pink or red urine may signify that there are red blood cells present in your urine. This is called hematuria. Be a sign of kidney damage or a kidney disease or inflammatory lesions that are located in the urinary tract. Pale urine can signify diabetes or diuresis. Frothy urine can signify proteinuria, and cloudy urine can indicate the presence of proteinuria also, or the presence of pus or white blood cells. Urea can also be the result of a blood clotting disorder, or it can be that the patient is on an anticoagulant drug. It is important to tell your doctor if you are on any type of medication, and for females, if you are menstruating or having hemorrhoids, as this blood can mix with the urine that will be used for the sample, and it will be very difficult to distinguish if something is actually wrong with you or if something is not. Urine that is too concentrated may be a sign of kidney damage, or that the patient is not drinking enough water. Levels of glucose in the urine can be signifying diabetes mellitus, and the urine of diabetics are normally very sweet smelling. They have a sweet odor, and this is due to the large amount of ketones or glucose that is present. Urine has a stronger scent of ammonia rather than glucose and ketones. Glucose in the urine can also occur in pregnant women or patients taking certain types of drugs. So, low levels of protein in the urine is normally undetected in a urinalysis. However, when there are high levels of protein in the urine, this is called proteinuria. Protein is not supposed to be in your urine in high levels. Result of diabetes, kidney damage, or hypertension. Urea can also be a result of stress, exercise, or taking certain aspirins. And in a case like this, repeated testing will have to be done to see if the proteinuria consists or if it's just a one-time thing. What are ketones? Ketones are substances that are created from the breakdown of fat, and ketones in your urine can signify diabetes that is poorly controlled. Ketones in their bodies may experience fever, metabolism issues, dieting issues, and once these substances are found in your body, your doctor will advise you to stay away from exercising, and he will also advise you to stay hydrated. pH can be used to describe how alkaline or how acidic your urine is. Normally, urine is slightly acidic. However, acidic urine can be a sign of kidney stones, and alkaline urine can be signifying that there is a urinary tract infections from certain bacteria in your body. So this is another reason why you should inform your doctor if you're taking any drugs at all, because some of them may affect your urine pH. Nitrite, this is another substance that is not supposed to be present in your urine. It can signify that there is a urinary tract infection, and the urinary tract is a very sterile place, and so bacteria can come from all over in your body and cause a UTI or a urinary tract infection. Urine has certain solutes in them, or they have things that are dissolved in them, and some of these dissolved products can form crystals in your body. Analysis can pick this up, and normally when crystals are formed in your body, it is as a result of metabolic issues. Bilirubin is a waste product that is present in certain types of liver diseases. Excess bilirubin is accumulated in the blood, and it is then eliminated in your urine. Presence of it in your urine can signify liver diseases in its early stages. Bilirubin and urobilinogen tests can also detect hemolysis, hepatic dysfunction, and biliary obstruction. When there's an increased level of white blood cells in your urine, it is signifying that there is an inflammation in your urinary tract or in your kidneys. Analysis can give us all this information. So now we see how significant it is to our health and our illnesses.
This is the end of our presentation, guys. Remember to like and subscribe.